Attendees are in listen-only mode.
Good afternoon, everyone. Thanks for bearing with us for a few minutes there. We are working through a few audio issues, so I think everything is worked out now. Hopefully you can hear us. I'm Chris Van Dusen with the Texas Department of State Health Services. Thanks for joining us. For another COVID-19 vaccine media briefing. I'm joined, as always, by Associate Commissioner Imelda Garcia and Chair of the Texas Expert Vaccine Allocation Panel. Dr. Saroj Rai is with us as well, our scientific advisor for any technical questions that may come up during today's briefing. With that, as a reminder, you can enter questions into the question box. Should be showing up on the right side of your screen if your screen is anything like mine. We'll take those questions after Imelda makes a few introductory remarks. The focus really does continue to be vaccine distribution and allocation in Texas, so happy to take questions on that topic today, as we have been over the last several weeks. If you would also remember to identify your outlet, so that doesn't automatically come up. We'll see your name, but the outlet doesn't automatically populate. So if you'll just include that in your question so we can recognize you appropriately, we would greatly appreciate it. With that, I'll turn it over to Imelda for a few opening remarks.
Thank you, Chris. It's good to be with you all today, particularly after a very difficult week across the state. And I hope you all have had a chance to enjoy a little bit of the warmer weather. Wanted to go ahead and just provide a few updates on where we are with our vaccine distribution efforts, and first and foremost, where we stand right now. So even with the winter storm stopping a lot of our vaccination clinics last week, providers in Texas have administered a total of more than 4.5 million doses of vaccine. Now that equals about 3.1 million people who've gotten at least one dose, and more than 1.4 million people now fully vaccinated. We continue to see the biggest increases in vaccination among people 65 and older. 38% of people 65 years and older have gotten at least their first dose, and more than 1 in every 7 are now fully vaccinated. More than 1 in 6 people 80 and older are now fully vaccinated, and so you can see our continued progress in vaccinating this critical population that is at the highest risk for hospitalization and death from COVID-19. Now switching over to some of our shipping updates. There has been a phenomenal amount of vaccine shipped to Texas over the last 2 days. We have about 1.4 million doses scheduled to arrive at providers' doors yesterday or today. And as you may know, CDC paused shipments nationwide last week because of the weather. And some vaccine last week did make it to some of the providers before that, but most did not get it. We saw a few doses trickle in late last week and over the weekend, but now we have a flood of vaccine in the last couple of days as the bulk of vaccine for last week and all of the vaccine for this week continues to arrive. So based on the latest federal shipping information, virtually all of the vaccine should be at providers' doors by the end of the day. And we should have close to about 90% of those doses allocated for this week also arrive. Now, I know that our providers have been eager to get back to vaccinating people in their communities and looking forward to catching up. Hearing some of the stories from providers doing all efforts in order to save vaccine has been awe-inspiring. And we've been hearing from providers all along the way that they have even more capacity to vaccinate people, and this is their opportunity to do that. I know it will take a little bit of time, but I expect that we'll be able to do that. As far as a couple of other things to mention, all of this week's vaccine for the federally supported sites in Houston and North Texas have arrived. They're making their final preparations and will start vaccinating people later this week. Also later this week, the Food and Drug Administration's Advisory Committee is scheduled to meet to make recommendations on the Johnson & Johnson vaccine. And by this weekend, we could have a third vaccine authorized in the United States. And this would be another huge development in speeding up our vaccination efforts. Chris, now I'm happy to take questions on anything related to the vaccine stuff.
Very good. We do have a couple of questions in the queue to start out with. As a reminder, you can enter those questions into the question box. We'll see that, and if you would include your outlet there so we can recognize you, that would be wonderful. First question is from Jessica Shorten at the Montgomery County Gazette. You touched on this a little bit, but how far back did delays caused by the winter storm set back vaccination efforts in Texas?
So essentially we lost about a week in order of actually administering doses last week. So this week providers will have last week's allocations and this week's allocations that they'll need to push through in the coming days. So essentially we lost about 7 days.
Gotcha. And any idea how long it'll take to sort of get those things caught up?
Honestly, hearing the big efforts that all our providers are doing in order to double up efforts to keep up on first and second doses this coming week, I think probably in a week and a half, we should be able to be caught up across the state, knowing that depending on provider, they may have different plans involved, but we'll get there soon.
Thank you very much. Moving on to the next, actually, another question from Jessica Shorten at the Montgomery County Gazette. There were several incidents in Texas and the Houston area in particular involving power outages causing emergency distribution efforts to prevent the loss of the vaccine doses. Were there any losses of doses due to the storm this past week?
Yeah, so we did have several providers reach out to us in order to help make sure that the vaccine was saved and administered before we lost that. Now, we have received reports of a small amount of doses by far in comparison. So we have about 1,000 doses that have been reported since last week as having been lost. Right now, we expect that as providers get back into their offices, we may get some reports of additional lost vaccine. But if that number represents it's an extremely small amount of the amount that is actually in the state.
Karen Harper at the Texas Tribune asked, do you know the allocation yet for next week?
No, not yet. We have not gotten our federal allocation as of yet.
Moving on to the Dallas area, Stephen Dial at Fox 4 in Dallas asks why the state reduced the dose amount at the FEMA sites in Dallas and Tarrant counties. This lowers dose allotment instead of increasing in the most populated counties.
So consistent with one of our expert vaccine allocation panels guiding principles, we need to make sure that we're allocating vaccine equitably across the state. And with additional doses coming to just those 3 counties, the EVAP recommended sending additional doses to parts of the state that haven't received nearly as much vaccine per capita. And this allowed us to allocate to over 230 counties this past week, the most that we've ever done so far.
And on that, sort of following up on vaccine allocation and how that works, Allie Morris from the Dallas Morning News asks, how does the state choose how to allocate its shots each week? Is it purely population-based? Are there other factors? And if so, what are they?
Thank you for that question. So it's a variety of different factors. We have population that definitely weighs in as far as guiding our allocations to counties across the state. But when we look and we talk with the expert panel, they help guide the strategies, the types of providers, and where we're trying to push either to targeted populations or special initiatives. For instance, our focus on our super seniors a couple of weeks ago came as a recommendation from our expert panel. They also provide recommendations on whether or not we are going to name any additional hubs or whether or not we need to change the types of providers that we're allocating from week to week. And so ultimately, all of those things come into play as we're making our weekly allocations. And that can change from week to week because the intent is as vaccine supply increases and as the expert panel provides those weekly recommendations, there are changes that may be included in each and every week.
Moving on to Abby Perot at the Big Bend Sentinel, is DSHS guaranteeing delivery of second doses that match up with administered first doses? And if not, why not?
So everybody will be receiving second dose shipments. Now, we know this past week, a lot of second dose shipments have been delayed, obviously because of the weather, but they will be coming. And so we want to reassure everyone that your second dose will be there. It may not be right there on time, and so we ask that you do check in with a provider that you got your first dose at to make sure that they actually have it on hand before you show up.
A question from Dana Driver, who's in line for the vaccines in Texas as far as the 1C group goes, and what's the timeline for the inclusion of that 1C population?
So our conversations with our expert panel are ongoing with regard to the 1C population, and hopefully we'll have a final recommendation on that here soon in the coming weeks.
And just as a follow-up, she also asked about where teachers stand in, who gets the vaccine, especially that there's a study that indicates teachers may be more significant of the spread of COVID-19 than students. I assume that's something that EVAP is weighing.
Absolutely. So, you know, the EVAP definitely considers all available data that we have on cases, deaths, and spread of COVID-19 vaccine when we're looking and making our decisions. So we will take this new information into consideration as we are deciding on what 1C population will be.
Ashley Soriano asks, and she is with KGNS in Laredo, asks if we've seen any evidence of vaccine distribution inequities when it comes to border towns and minority communities. This stems from meetings that local officials have had in Laredo and South Texas addressing what they view as inequities in this aspect.
I would say no. When we look at the data and the counties based on our allocations and that map that we had provided the past couple of weeks, the border counties are generally in line with the general proportion of the population that they are when we compare it to the amount of vaccine that we're getting each and every week.
Valerie Gonzalez at the Monitor, staying down in the Valley. Some school districts started the process to become vaccine providers, with some being successful. Some intend to use allocations only for their students or staff. Do regulations prohibit them from closing that access off?
So with any COVID-19 provider, we want to make sure that they are following all of the state requirements with accepting that responsibility. And so depending on where we are in the vaccine supply chain, there may be different rules that apply with that. But right now, the vaccine supply is fairly limited, and they may not be able to offer it beyond their own employees that fit the current eligible definition.
And I guess that's a distinction to make between, you know, kind of the hub providers that have been named and the you know, kind of those other providers who are out there receiving vaccine.
Absolutely.
Those are the questions we have right now. I'm just scrolling through to see if there was anything we had missed. Let us know if there is. Karen Harper asked, Karen, a fairly specific question about the doses, the spoiled doses related to the storm. I'll have to look at that. But Karen Harper at the Texas Tribune asked about the number of doses in the Friday report. Says that 797 were wasted, and asked whether there are additional information that have been reported but not yet posted about you know, the fact getting close to 1,000.
Yeah, so we have about 1,000, and we will update that on our Friday report with any additional information that gets reported later this week.
Mitch Borden in Marfa Public Radio, with Marfa Public Radio out in West Texas, asks that in the Midland, Odessa area, there are a couple of hospitals designated as vaccination hubs that are going to be adopting the CDC's recommendation for Phase 1C. By distributing vaccine more broadly. I know we had a conversation with the hospitals out there, and that's not something they're planning to do now. We kind of you know, reiterated that with them. I don't know if there's anything else you'd want to add to that.
No, Chris, you're right on point. Conversations were had with some of the hospitals out there, and everyone is clear and agrees to stay by the state of Texas eligibility guidelines for 1A and 1B. Vanya
Patino, at Channel 10 in Amarillo asked if there are any updates to the distribution to rural areas or the Panhandle, any changes or possible new hubs in those areas.
So at this point, the expert vaccine allocation panel has recommended not to name any new hubs for now. And with increasing supply coming along each and every week, we have been able to make reoccurring allocations to some providers that are not hubs. So that's one thing that you'll start noticing across the state, is that we are pushing more consistent vaccine across, and in particular to some rural counties, even without that hub designation.
Got it. Those are the questions I see today. And one more has just popped up. Avery Perot, back out of the Big Bend Sentinel, asked whether the vaccine allocation panel is taking into account disproportionate deaths among certain populations or counties when making its allocation decisions.
So when we look at the cases and the death rate at, each and every week, the biggest piece that we look at is how does that play into the vaccine allocation distribution? And ultimately, the amount of vaccine that we have really can either give us greater flexibility in being able to address some of those ongoing outbreaks, or other times, because the vaccine may be fairly limited given what our commitments are, we may not be able to increase allocations from a week-to-week basis.
One from Ashley Lopez at KUT in Austin. How could the possible addition of other vaccines besides Pfizer and Moderna into the supply chain affect the state's overall distribution plans?
So obviously, the more vaccines that we have, the better, and the more brands and the more options that we have always adds to our efforts all across the state. Now, with the Johnson & Johnson potentially being approved later this weekend, ultimately we will see what populations are recommended from both the Food and Drug Administration as well as the CDC's Advisory Committee on Immunization Practices. And as those recommendations come out, those will help guide how we may potentially distribute the Johnson & Johnson vaccine.
Great. Thank you very much, Imelda. That was the last question we had in the queue at the moment. So appreciate everybody being with us. If you have anything else, there were a couple of follow-ups. We'll follow back with people on, but feel free to reach out to us at pressofficer@dshs.texas.gov. That is, well, you know, I think we've got time to take. We had a couple more pop up. Let's go ahead and take those. We do have a few more minutes left before we have to cut things off. Question from Ashley Soriano at KGNS. What is DSHS or the EVAP view on cities partnering with third-party companies like Curative to assist with administering vaccines?
So ultimately, we leave those decisions up to the local officials and the best way for them to be able to administer the vaccine in their communities. Our main point is that we are providing the allocation to those counties to serve their constituents. How they operationalize that is up to them.
And finally, for Valerie Gonzalez at the Monitor, will the 7-day delays caused by the weather last week mean the next allocation will be delayed to allow providers to catch up?
No, we still plan on pushing out week 12 allocations on time. What we've asked, and some of the providers have told us where they may not be able to handle the additional vaccine. Some of them have declined or told us that they don't want to receive any additional vaccine that coming week. And so we are honoring their request, but we will be proceeding with this next week's allocation on time.
Once again, thank you, Imelda Garcia, for being with us today. Thank you all for your questions and your attention during this briefing. We'll be back in touch with plans for our next briefing. Continue to do these on a regular basis. Again, hope everybody has weathered the storm last week and getting back to enjoying the nice, more typical February Texas weather out there. Thanks, everybody. Have a great rest of the week.